Good morning, everybody, and happy Thursday. Thank you so much for joining us today for a very special presentation by Jessica Regan, System Director of Hospital Care Management, about the Park Nicollet Patient Special Needs Fund. And so without further ado, Jessica, thank you for being here, and I will kick it off to you.
Thanks so much, Abby. I appreciate it. Abby, as Abby said, I'm Jessica Regan. I'm the Assistant Director for Hospital Care Management, Health Partners, and Park Nicollet. Previous to this role, this is fairly new for me. Previous to this, I was the manager of Hospital Care Management at Methodist Hospital for about 6 years. So this topic is very near and dear to my heart. I'm very excited to be here and talk about the Patient Special Needs Fund and the amazing impact it's had at Methodist Hospital. So to start, this is just a high-level agenda. I'm going to talk a little bit about what the care management department is that I support, the background of the need at Methodist, some examples of the items that this fund supports, how we identify needs with our patients, the grant approval process, and also some of the community partnerships that we've developed along the way. So to start, like I said, I support the hospital care management department at Park Nicollet. We've are called lots of different things. So sometimes it can be social services, care coordination, case management, but we're actually 50-50 social work and nurses. So on the social work side, we have social workers on our medical units. We have some dedicated clinical social workers in our family birth center and our intensive care unit or ICU. We also have a mental health social work team. Now, while Methodist does not have an inpatient psychiatric unit, we often have patients that are admitted to the hospital awaiting a mental health bed when the beds are full across the state. And so our mental health social work team partners closely with our psychiatry consult team to help care for those patients while they're waiting for a bed. We also have emergency center crisis social workers who perform crisis assessments on mental health and substance use in our ER. On the nursing side, we have RN care managers on our medical units. We have a dedicated nurse for any hospice coordination. This can be a social worker, but it's typically a nurse. And then we also have emergency center RN care managers as well. So care management, the overall goal is to really try to ensure a safe and sustainable discharge for our patients that are transitioning out of Methodist Hospital. So this could be anywhere from helping set up some extra services, home care, things like that at home, to placement, to looking at an assisted living, a group home, a TCU, a nursing home, and then to all the other things that our patients face. So helping support grief and loss, adoption, surrogacy, mental health, domestic violence. The list is kind of endless. We really help patients and support patients with a lot of different challenges that they're facing. So to start, I want to give a little bit of background on why this fund is so important to us and how this has been so helpful. Post-pandemic, we started to see a change in our patient population at Methodist and really saw an increase in our aging population that was experiencing pretty significant isolation, perhaps really extremely limited support networks, if any at all, and significant financial strain. Many times these are patients that perhaps really didn't have any close friends or family. Maybe a neighbor just hadn't seen them for a while, called 911. 911 went out and maybe the patient had a fall. They found the home to be in really significant disarray. Maybe they're struggling to afford food, to keep their heat and electric on, or their plumbing. So we just started to see an increase in those situations coming into the hospital. A subset of those were also patients that were really struggling cognitively. So perhaps they had advanced dementia, they were really confused, and they weren't clearing the longer they were in the hospital. And without any sort of family or friends that we could find, there were instances where we had to go and petition the court for a legal guardian to help have some supported decision making and have someone that could help make safe decisions for them when they left the hospital and ensure that they had a safe place to go. Overall, we were also just seeing an increase in patients just really struggling to ensure their basic needs were met. So, clothing, food, housing. And in addition to that, just seeing an increase in our patients that were homeless or unhoused. One contributing or one change that kind of helped shine light on this issue was in 2024, the Centers for Medicare and Medicaid, CMS, requested that all hospitals screen all patients that are being admitted to the hospital for what's called a social determinant or a driver of health. And these are five primary domains: food insecurity, utilities, transportation, interpersonal safety, which screens for abuse and neglect and domestic violence, and housing. So, asking these questions to all of our patients that were being admitted to the hospital going forward to help us understand some of the things that patients are facing and struggling with. Additionally, we started to experience and still experience pretty significant county and court backlogs. So I mentioned previously that there are situations where we have to file for guardianship, or even sometimes in cases where family is filing for guardianship, that can take a very long time. There's still significant backlogs in probate court. Patients can wait anywhere from 2 to 6 months waiting in the hospital for these hearings to occur. Well, really, that's the only thing that's keeping them in the hospital is just someone to help support them and make decisions as they discharge from the hospital. Same with the county. There's I think, a general just lack of awareness. I don't think it's shared very much about the funding for assisted livings. So we had many patients coming to the hospital asking to for help in moving into an assisted living. However, unless you're able to privately pay for that, there's some additional county support and waivers that are needed. And there was backlogs there as well. So these patients were waiting weeks to months for those assessments to get the funding to be able to move into a safe environment. So, with all of that background, the Patient Special Needs Fund has been really, really helpful for some of our just in time needs of the patients that are here at Methodist. So, these are just some examples of what we have been able to use the fund for. So, clothing is the biggest one. We often have patients that come into our emergency center in the middle of the night. Perhaps they've been living in a shelter on the street. They are really, their shoes and their socks are in rough shape. And so, being able to give them some new shoes and socks, be able to hats, mittens in the winter time, and just clothing in general, or perhaps the clothing came in and was very dirty and they need something to wear home. Transportation from the hospital, this could be anywhere from a bus token all the way to a stretcher ride. We do have patients that come from all over that are transferred to Methodist. And so perhaps someone came up from Hutchinson and they're really struggling financially to be able to afford that trip back down to Hutchinson. So we were able to help with some of those things. Gas gift cards, Target gift cards, formula, car seats, durable medical equipment. This could be wheelchairs, walkers. We've had several elderly patients who are living in shelters with broken walkers. And so being able to help replace the walker, which is typically not always covered by insurance. And so just being able to have some safe equipment for them as they leave the hospital. Medications, really looking at those that are really crucially needed, not covered by insurance, and maybe a short-term basis. I mentioned patients that were awaiting guardianship. So this can be several months in the hospital, and these patients are often, they're not able to make decisions on their own. So there's lots of confusion. There's typically dementia, and it's very boring to be in a hospital for that long. They're not getting visitors. They often don't have friends or family. And there's not a lot of personal items that they often bring in. So we're able to use this fund to try to personalize their experience and make it as comfortable as we can for the time that they're here. And I'll share kind of a more detailed example of that a little later on. We're also able to fund some home care visits, which can often be a nurse coming in and checking on patients on a time limited amount if they do not have the coverage to do that. Because again, our goal is to try to reduce them coming right back into the hospital as well. So if there's something that we can put in place on a short-term basis to help keep them safe and healthy in their home, we try to go that route. Unfortunately, we also have to use the fund for burial expenses, which is very hard and and sad. We have several patients that have passed away in our hospital without any family or friends, or there's been some discord in their life and the family is not wanting to remain involved. And so we partner with some local funeral homes and the county on burial assistance, and have used the fund to fill some gaps to ensure that their wishes are met, and that we're able to honor whatever the patient is asking for, when we can know what that is. Um, IV antibiotics, tube feed supplies, a lot of coloring books, activities for kiddos, whether they're patients or they're here with a parent or grandparent. As I mentioned before, we often have pediatric and adult patients that are waiting for a mental health bed. And so while they are seen by psychiatry, again, we want to try to do what we can to help with their mental health while they are waiting for that bed. So we have a lot of fidgets, puzzles, games, activity books that have center around mental health for things for folks to do while they're waiting for that needed care. So, how we identify who these patients are, as I mentioned before, the primary goal of the use of the Patient Special Needs Fund is patients that are significantly struggling financially and they have limited to no supports. And I'll talk a little bit later about how we kind of screen through the other options. These patients are identified through the whole care team. So perhaps it's maybe something that's shared with a nurse when the patient is first here, maybe something that is shared with one of the physicians. Really, just a lot of conversations and talking about these things come up throughout their stay of something that someone might be struggling with. Methodist also has a very cool program called Getting to Know Me, which is a patient interview, and these patients are identified through the care team, or perhaps they're patients that are struggling somewhat with some confusion, and we're really just trying to get to know the patient to understand what might be helpful in calming them down and helping them feel more at ease while they're in an unfamiliar place. So the questions are centered around, what the patient did for a living, what the patient likes, what type of music, what type of food, what they don't like for food and for music, what helps them calm down, what kind of words or response from staff is helpful and what isn't helpful. And so writing up these getting to know me interviews and then making sure that they're visible to the rest of the care team has been really helpful in reducing um, just some of that unease that patients feel when they're here in an unfamiliar place, especially if it's somebody that's struggling with dementia, or some confusion of sorts. So we get some information from the getting to know me, and we typically try to do those with the patient. And then if they're not able to answer all the questions, we involve family and friends whenever possible too. Care management does a lot of screenings and assessments as well, and to determine some of the needs and some of the focus and how we can communicate or how we can connect them to community resources as well. And then, as I mentioned before, that CMS screening that is completed by the bedside nurses upon admission to the hospital, that's really helpful, and relatively new in the last year. And so that information and the responses from patients is visible in the chart for the social worker or the RN care manager to look at as well, to try to help connect them to resources or help identify what kind of support they're looking for would be helpful to them. So how the process works in our department is, so the team is notified either by the patient or by a care team member of the need. We talk with the patient more. We always try to exhaust any other potential options. So we're very grateful for this fund, but we want to be very fiscally responsible of the money that we are able to use. And so we want to make sure if this need could be met in another way, through insurance, a community partner, friends or family, trying to be creative, and looking at what other options we have that could potentially be a workaround. A lot of what we use, the Patient Special Needs Fund, is really just in time resources, and then we're connecting them to a community resource to help beyond the hospitalization. So these costs don't typically extend beyond discharge. And then the frontline team member places a grant request to the leadership of the department if there's a cost associated with the request, and then leaders review that and process that accordingly. So here are a couple just high-level examples. I took out most of the details and changed a few things just to protect patient privacy. But one of the examples is we were able to use the Patient Special Needs Fund for some headscarves for a very young patient who was newly diagnosed with terminal cancer. We were able to get a wig through the Angel Foundation, but that would take a little bit. And so there was, the patient was having a really hard time, understandably, losing their hair. And so we were able to do some headscarves that the patient was involved in picking out some designs just to try to make, again, a really tough situation, maybe a little bit brighter where we could. We also were able to assist with a patient who was up here in Minnesota, we believe likely trafficked with the promise of a new job, non-English speaking, some young children, no resources, no financial supports, and just really desperately wanting to get home and to get back. So we're able to help coordinate that and care for the children to make sure that they could get safely back to their home. As I mentioned before, we often have patients waiting for guardianship, and in one case, we had a patient awaiting guardianship. The court was out about 3 months, so the patient was going to be with us about 3 months. No family or friends, no personal items. We did a getting to know me and found out that the patient had a very strong love of a particular singer who the patient actually met many years ago. And so we were able to use this fund to purchase a couple items related to that singer to really brighten up the patient's space and their experience in the hospital, which the patient was very appreciative of, very tearful and excited to see. This patient also loved Christmas. And so this and was happened to be hospitalized around the holiday season. So we were able to also add some additional things just to brighten up the room while they were waiting. Because again, typically these patients are moving into a new environment post-discharge without anything. Maybe they have a couple personal items, but generally the home previously has been condemned or we're not able to get any of the personal belongings. So through all of this, we've also had some great community partnerships. As I mentioned, we really value those and we could not do it alone. And we really need those community partners to be able to help our patients. And so one of the partnerships we have is Outpatient Outfitters. So I mentioned earlier that clothing is a really significant need. And Outpatient Outfitters really provides Methodist, along with several other local hospitals, with free clothing. And so they are a nonprofit, and they can bring in new and used clothing. They're a great organization, and they've really helped us at a no cost to be able to provide some of these clothing. So the Patient Special Needs Fund is really used in the case of filling the gaps of whatever Outpatient Outfitters can't provide, but they've been a great partner to help our patients. We also partner with Second Stork and Bundles of Love. These are both within our family birth center, and they provide clothing, usually preemie to 3 months, pack and place diapers, diaper bags, again, at no cost to the hospital. So we've been able to partner with them to reduce cost from the Patient Special Needs Fund. Hunger Solutions, they assist with kind of longer term support with food shelves, also helping patients get on benefits to help with food assistance. So they can follow patients beyond discharge. As I mentioned before, they're a great partner. We can refer to them in the hospital. They'll contact the patient while they're still here, and then help work with them for as long as they need help to ensure that they're getting food and getting their food security needs met. The Humane Society is a newer partnership in the last year, and that's been a wonderful partnership. So we have seen an increase in people and in pets being almost a barrier to people seeking medical care. So if they're very close to, they have a close relationship with maybe, say, their dog or cat, they don't have anybody that can watch that animal, and they maybe have to come in for a procedure or they're sick. There's a lot of stress related to who's going to care for my animal. I don't want to lose this animal. They're primary support for me. And there's some avoidance of coming into the hospital. So and also, we have some folks that are maybe just coming into the hospital, bringing that animal because perhaps they're unhoused and they've been living, and their primary support is the animal. So we partnered with the Animal Humane Society last year, and they provide 60 days free respite care to pets while folks are hospitalized. So they've been a really great partner. If they have the capacity to help, they will. And then they also help providing pet food, pet supplies. They've provided some of that to Methodist Hospital as well, because when patients bring their pets in with them, we need a safe place to keep the pet while we're waiting for it to be picked up. So they've been a really, really great partner for a need that we've seen increasing over the last year as well. And that, I think, is a great win because it helps keep that support system for the patient. They are able to still have their pet. They know that their pet's safe. They're not going to lose them, and then they can get the medical care that they need. And then there's so many other informal partnerships that we have for community organizations. Like I said, we could not do this alone. And so this Patient Special Needs Fund really helps us identify some of those gaps that we have. And then how can we partner more in the community to help make sure that these needs are continuously met, or patients have resources before they even get to the hospital in some cases. So lastly, this is really just kind of an overall impact of the Patient Special Needs Fund. This impacts hundreds of patients each year. Our need has been steadily increasing over the years. And every time we use this grant, it makes a very positive impact on patients' lives. Like I said, we're only seeing an increase. And so this support has been really helpful to help take some of the burden, or lift some of the burden on some of the things that patients are facing, in addition to all of their medical needs. And concerns as well. And as I mentioned before, this has also helped us increase our community partnerships. So looking where we have gaps and where we can partner more with the community to make sure that the needs are being met of our patients. So thank you very much. That's the end of my presentation. The questions.
Jessica, thank you so much. And just on behalf of myself and my team at Park Nickel Foundation, thank you for all the amazing work that you and your team are doing to help people in our community and patients with all of their unique needs. And we do have some questions here. Let me just get this pulled up. One moment. Okay. First question is, if you had to say now, do you think that the common needs addressed through the Park Nicollet and Methodist Hospital Patient Special Needs Fund will change drastically in the next 3 to 5 years? Stay pretty similar, or what are your predictions on that?
I think if we're looking at based on historical since COVID, I mean, it has steadily increased every year. So I do anticipate that to continue. Um, I think I think that our primary focus is, trying to increase those community partnerships where we can, but we really haven't seen any sort of reprieve. I mean, we're just seeing more folks struggling, and there's just more general awareness of it because we're asking the questions that maybe weren't asking directly before. So maybe before, things would come up in conversation, you're not always talking about, you're struggling to pay bills at the doctor's office or when you're in the hospital, but now we're directly asking those questions. So if I had to make a educated guess, I would say that we're going to see an increase, especially as our compliance for that screening questions continues to increase.
Thank you. Another question for you is this update for patient special needs is so important where the rubber meets the road. Oh, I'm sorry. It's just a nice compliment for
Oh,
your presentation. My apologies. But I also have a question. You had mentioned community partnerships during your presentation. What additional community partnerships do you foresee Park Nicollet fostering in the future to address Patient Special Needs Fund, patient special needs as they arise? It sounds like you were saying that you just foresee that it'll increase. So, what additional community partnerships do you think will you guys be fostering?
I think we want to make sure that we have the right partnerships that meet the needs of the patients, and that's really kind of forever changing. And so, we I think with the data that we're going to gather from the CMS screening will be really helpful to kind of direct our partnerships and make sure that we can't just have one, right? So I mentioned hunger solutions as an example, but we also need to have additional resources that work with other folks, the people that have just in time that they can go straight to a food shelf. Looking at there's a free grocery store over in St. Paul, if there's not really that opportunity over here on the west side right now. So I think just it's going to be, in my opinion, it's a constant analysis of the needs of our patients, also making sure we're taking into cultural considerations, making sure that we have resources that we're giving patients in their own language, so that they can understand and they can connect to the resources that they need. That's another big piece of it in health literacy. So I think that I don't have a great direct answer, but I feel like those partnerships are continuing to evolve as the needs. And I'll say one more thing is the pet resources one, that's really been huge over the last year. And so and there's been more of them. So we went for years without really having much of a pet respite options out there to now there being more and more, which is really cool. So being able to even gather multiple and different things to give patients different suggestions and ideas so they can also weigh things out. The Animal Humane Society is dogs, cats, and critters. We don't have one for birds. And we had somebody recently with a bird. So just like kind of pivoting to find, well, how can we help or what resources can we find out there that could help with a bird? So just as some of them may be one-offs, but you'll probably get that again in the future. So it's just good to have a lot of resources where we can, I guess, in our arsenal for patients.
Excellent. Thank you. Another question for you is, do all healthcare systems have patient special needs funds? How do our resources compare? And what could we be doing more to support our patients and their families?
Oh, that's a good question. I'm not super familiar on other health systems. I've worked at some, and I know there's some minimal funds. I think we have a little bit more of a robust fund. Well, I would say it varies on what can be covered. I think that the reality is what patients are struggling with is everywhere, right? It's not unique to Methodist. Hence why CMS is implementing the social determinants of health nationwide. Is really having these basic needs met directly impacts your ability, your overall health. And so I think that there's a constant kind of increase. I would say there's a lot of sharing back and forth of resources. So even from a care management perspective, I have connections with a lot of leaders of other care management departments at other hospital systems of just what are you doing for this? Do you have a resource for this? So a lot of sharing. I don't know the specifics of, I guess, their funding and what they're able to cover, but there's a lot of resource and partnership sharing. That is how we directly got involved with Outpatient Outfitters, is that they were serving another healthcare system and they suggested it to us and we were able to get connected with them and have a partnership with them as well. So I guess to me the thing that folks can do is just its awareness. I think it's really important for people to understand just what others are struggling with, and it's not really, I mean, we're continuing to see it, and so I think talking about it, looking at opportunities to help support our patients, yeah, that's just, I think, the biggest thing, and just understanding that there's a lot of other things that impact patients' health that we maybe don't always talk about in a medical setting. That is really really important to talk about because it can really have a direct relationship in their health.
Thank you. And have you ever ran into a situation with addressing a patient's needs where there was not a resource to address that need? Could you, by any chance, provide an example of that, if there is any?
Yeah. Yeah, I would say sometimes and we try to get pretty creative, and this is where the Patient Special Needs Fund kind of can come in handy. But I would say that what we run into is patients that maybe are kind of on that border. So maybe they make too much to qualify for county assistance and support, but not enough to meet their basic needs. And that's a really tough, excuse me, really tough place to be in. And that's challenging. So there's a lot of navigation of that, trying to find, especially let's say they're trying to move into an assisted living and they're not quite able to get that funding. So trying to look at helping connect them to legal resources. They want to look at more of a spend down or where they can put their funds and manage all that. We try very hard not to be involved in their financial pieces, but also helping direct them to databases and free services that can kind of help navigate some of those systems. I mean, the system is very complicated to navigate anyways. And so I think what we try to do what we can to make that as easy as possible. But I would say there's nothing really that stands out. I'm sure there's been some here and there that we just can't, like, oh, the pet resource one for years, we really struggled with that. Um, but nothing's coming immediately to mind, just other than a few one-offs. But we love a good resource. So anytime we can find something new that's opening up or everyone's sharing it to try to utilize that and making sure that if we have a good experience with one as well, that that's shared too.
Thank you. And another question for you is, what are some ways we can continue to reach out to our colleagues at Methodist and Park Nicollet to let people know about these resources?
Um, I would say that continue to, I mean, any sort of sharing of it is helpful. I think we're constantly trying to remind people that we have this. So for example, a lot of the clothing, where it's stored at Methodist now, we've brought in that. So it's not just care management closet. So we have some stored in the emergency department. We have some stored at guest services so that no matter where the need is, that they can have it. Because it can't just be in the silo. I mean, care management ultimately manages it, but we want to also make sure that we have awareness. And there's a lot of staff changes and lots of people that work at Methodist, and so it's kind of a constant reminder. We put it in newsletters for different departments. We've shared about it on and off in different meetings, but I appreciate any continue from just everybody to as they talk with people too to remind them that we have this, because it probably comes up once a month where someone will ask, we don't have it, or ask the foundation and the foundation will kindly direct them to me. So I think, and I'm also open to any ideas or thoughts. I'm happy to talk about it anywhere else, but we've tried to really broaden that, so just so people have more awareness of, oh yeah, we actually have some winter coats up at the blue rent exit, for people that are really struggling or coming in. Same with our taxi vouchers. We have some elderly folks that have gotten confused. They've taken a taxi to the hospital, meaning to go to a different clinic, and they're quite flustered and they're struggling with the cost then to get to the correct place. So just trying to where we can share resources to help ease our patients' burden, we try to do.
Thank you. And I had a quick question for you, kind of dialing back to the beginning of your presentation when you were going through the social determinants of health that, uh, like major categories that you guys assist with the Patient Special Needs Fund. What barriers are you and your team experiencing with social determinants of health data collection in general, and how is that affecting the work that you guys do?
Sure. Yeah. So I think it's just a learning curve, right? People aren't generally used to getting these questions when they come into the hospital. So you're in the hospital, you're probably in pain, you probably don't feel well, and someone's asking you questions about, are you paying your utilities? Are you struggling to pay your bills or your food? Or to, if you're worried your food will run out. And so I think we've gotten a lot of feedback from patients of like, why are you asking that? Like, that's not why I'm here. And so I think it's a continual education process of that really important connection, that if someone is worried about where they're going to sleep that night or where they're going to afford their next meal, they're likely not thinking understandably about getting to their appointment or paying for their prescriptions. They're really focused on those true, very important basic needs. And so if they're not able to meet that, there is a higher likelihood that their overall health is struggling as well. So we're really trying to educate people just in that important connection, and that we can help with some of these resources, or at least point them in the right direction with some of the community resources if it's something that they're struggling with. And just that we value the whole person. I mean, it's just like mental health. It's really important. It's not just a medical model, medical focus, but we care about the whole person and making sure that we are doing what we can to care for them and to help make sure that their needs are met and that their overall health is as good as it can be, as good as they're open to. So
Thank you. And I love what you said just now, where you care about the whole person, like through your examples and through your presentation when you were sharing all these different examples. That's so apparent to me, just that you guys really do care for the whole person. And I think that just from my perspective, from your presentation today, Park Nicollet and Methodist Hospital are so good about, ca- from a patient special needs standpoint, caring for the whole person, making sure all their needs are met beyond, like their medical needs. And so, I think the work that you are doing is excellent, and so thank you. If anybody has any other questions after the presentation, could I send them your way, Jessica?
absolutely, yeah, absolutely.
Well, thank you for your time, and again, thank you for the wonderful work you do every day, and I hope everybody has a wonderful day. Thank you for joining.
Thank you so much.
Bye-bye.